All right. Hello, everyone. My name is Alyssa Joseph Bowitz, and I will be presenting my outcome evaluation project that has focused on NICU cribside cameras. Um, the angel eye in front of the NICU camera title, that's just the company that makes and produces, sells NICU cribside cameras. And then special thanks to my supervisor, Jean Decker, and the NICU unit clerical associate staff. They've been super helpful with this evaluation project and super encouraging. So we'll get started. Where this evaluation project has taken place at, it's been within the hospital system at Ohio State, in the Wexner Medical Center, within the NICU, or at the NICU at Ohio State. It's owned and operated by Children's Hospital. Ohio State is an adult hospital. Children's is a child's hospital. So having children's doctors and pediatricians within the NICU at Ohio State just helps with best outcomes for babies and just having the specialty doctors in units that they specialize in. So yeah, that is where the context of this evaluation project is. And then I've been working with clinical medical social workers. That's my supervisor, Jean, in LISWS. And then the clients that a NICU serves are the patients, the babies. Those are the clients, but because babies can't talk, we work with the parents, the families, any other adult that is associated with this child. So that could be foster families, that could be adoptive families, also children's services. So we work with all the family members of a NICU baby, and those are the clients that we are serving. And then the main problem that we see within the clients are increases in anxiety and depression symptoms. And then this outcome evaluation, the desired outcome is to find out what is out there that can help decrease the anxiety and depression symptoms. And then the evaluation question of this project is as follows. Do cribside cameras for NICU babies help reduce symptoms of anxiety and depression in newly delivered mothers, their partners, and or caregivers? And then some other evaluation questions that have been asked are if the cameras are easy to use, if the cameras make parents, caregivers, other adults feel included in the care of their baby, and also if they think these cameras are safe to use and protect the, identification of the baby. And then right here, you see this big medical contraption. That is something called an isolette. Babies get put in isolates just to kind of protect from, outside, like dangerous things, and can help with regulating temperature and stuff, especially if the baby is really small, like 2-3 pounds. Being in an isolate is super important to help that baby get better. But this picture is an example of what a cribside camera is. So you see that long arm kind of peering into the isolate. That is the camera itself. So that is what this evaluation has evaluated. And then here is my logic model. According to the CDC, logic models help depict the relationship between the program's activities and its intended effects. So with this, it really helped me better understand what the cribside cameras were supposed to do in the first place, and also see like all the different things that these cribside cameras touch. So, truthfully or the main purpose is, these cribside cameras want to decrease anxiety and depression, but it can also help increase parent involvement in the NICU. It can decrease negative thoughts toward NICU staff. It can help with parents and NICU staff collaborating better. So yeah, truthfully, this logic model has just, given a very wide picture of everything that a cribside camera can do in a NICU. And then my reasoning behind choosing cribside cameras as the intervention or program for this evaluation is due to the, the intersection of social work and medicine. So this intervention, it is a social work intervention. It helps with, or its intended purpose is to help reduce mental health symptoms, but this also is an intervention that helps medical staff. So as a medical social worker, you work with multidisciplinary teams, and the intersection between many disciplines, they're there all day, every day. So doing this evaluation about an intervention that there is an intersection between social work and medicine and other disciplines is super important, because if it was just social work, not a lot of people might have been interested in it. So having this also be a medical intervention was great to do. It just was a great option. So, all right. Okay, and then the literature review that was completed, there is not a lot of information out there for cribside cameras, but there is information out there in some reviews talking about the things that have helped parents and families and other caregivers to help them get through their child's NICU admission. I always talk to people that, being in a NICU, it's not really expected. It's, a weird situation. So, what was found out there in the literature review and the best practices have really shown support groups being the main intervention that have helped the adults within NICUs. So you see that, health education, educational materials like videos and manuals that kind of teach about how to take care of your baby and their medical needs, teaching families and parents about the NICU and the ins and out of the NICU and stuff, getting a routine, coming to see your baby every day. Also having support groups that have, psychologist support, social work support, also some support groups that apply relaxation techniques. And then, support groups also talking and covering educational materials, but also emotional aspects of what these adults are feeling. These have all been, studies that have shown great results within the families in a NICU. There was one article about virtual visitation. It did not specifically talk about cribside cameras, but it talked about, a computer supported network and how families had confidence in using virtual visitation and its security behind the virtual visitation. So because cribside cameras are, a newer technology, that's why there's not a lot of literature out there, but the literature found definitely helps support, the foundation and the reason for cribside cameras, and leaves a lot of room to publish future studies about NICU cribside cameras. So, all right. And then, there are no systematic reviews because it is cribside cameras are a new technology. All right, so the outcomes measured were if there are decreases in anxiety and depression symptoms of parents in the NICU. And then the outcomes also measured were the connection between the parents and their baby, but also parents and the NICU staff. Those two things were measured. And then to measure those, a measurement scale that was created, kind of modeling the Edinburgh postnatal depression scale, was used to collect data and to measure. The EDPS has shown excellent performance, low risk of bias, has, best reliability for pregnant and postpartum women when it comes to identifying depression symptoms and the severity of depression. And then also it's shown great convergent validity. So it was a no-brainer, creating a scale that mimics the Edinburgh. It's also used in the postpartum unit at Ohio State. So we work with moms that are recovering in the postpartum unit upstairs at Ohio State. So if they, have already used the Edinburgh and kind of feel comfortable, having them take this test would just help them feel more comfortable with providing genuine answers. And then I was the one who was doing all the measurement and data collection when it was really just dependent when I spoke to families and who I was speaking to, and then where it was at the NICU at Ohio State. And then some issues I encountered were some language barriers. Ohio State, we work with a very diverse population, especially those who where English is not their first language. So using interpreting services, it wasn't a big issue, but just making sure that, questions were being interpreted correctly, rephrasing the questions that I was asking to make sure that the participant was fully understanding. Timing was also an issue. Hospitals, there's just a lot going on. So sometimes, going in to speak with a family, they're not there. They're, breastfeeding, doing something else. So timing was just trying to figure out times that I could talk to families. And then the last issue is just remembering that this is my field practicum also. So I do have required tasks and goals to reach. So kind of just balancing my data collection, measuring, and then doing my required tasks. And then my evaluation design, I use the post-test only one group evaluation design. And this design assesses the status of program participants at the completion of the program. So using this design was one of the options I could have used, or one of the only options, just because in a hospital, everything is so uncertain. Never truly know when a patient is getting discharged. You never really know when babies are getting admitted. Sometimes we can try to predict discharges or admissions, but things happen, things move around so quickly that doing any other type of evaluation design just really would not have been feasible. So doing, a one point in time measurement collection of how a family, like how a family was doing after using the curbside camera services, that was a great way to get measurements about decreasing anxiety and depression symptoms. And then also for this evaluation design to kind of work, or here, wait. So there were threats to internal validity. Actually, this type of design does not have internal validity. because there's no way to identify if there were outside factors, um, if there are outside factors that have influenced the results. So to combat this threat to internal validity, um, I was working with families just exactly just around the time that they had been there for a week, that their baby had been there for a week, to kind of not allow for outside factors to affect this study. And then also the questionnaire really focused on um, asking questions about how they felt when they were using the camera. So not, when you're at the grocery store, were you thinking about your baby? It's, truly just asking about if the cameras helped. So those were ways to kind of address the absence of internal validity. So for data analysis, these are the questions that I asked. So for the negative questions, they would score them on a scale of 0 to 3, 0 being no, not at all, and 3, yes, all the time. So kind of comparing, contrasting the negative question scores and the positive question scores. Managing the data, I use Excel. And to show the results, I used bar graphs, and I used a paired samples t-test, which down below you can see the formula for that. So this is the first graph. This shows the negative questions, the scores for the participants. So mostly you see a lot of lower scores. So that is kind of shows that for most of these parents, they weren't feeling any, negative effects or negative symptoms from using the cameras. And then this graph shows the positive question score. So you see, an uptick of a lot of higher scores, which shows that, the cribside cameras were, actually, they were helpful towards mental health symptoms and just overall functioning day to day. And then this is the paired samples t-test that shows the comparison of means. So we see up at the top that the negative mean was 0.295 or 0.30, and then positive was 0.66. Because these means are not exactly the same, it shows that this was statistically significant. And because that t-stat down there is at that negative 4.39, it's less than 0.05. So that also communicates that we reject the null hypothesis. So saying that, yeah, the null hypothesis is that they would be, there would be no difference. Well, there is a difference. So that is significant. So then to wrap up, I concluded that, yeah, these cribside cameras do help parents and the adults in NICU babies, helps decrease symptoms of stress, anxiety, and depression. Also found that these families, by using the cribside cameras, they do feel more connected with their newborn and the staff. Unlike, not using the camera and only coming in for once a day or something like that. Informing or guiding my practice, these results did help me guide on, or help me to guide, future endeavors. These cameras did help, but sometimes the results show that they did not help. So this, guides my practice to kind of ask, what alternative interventions can we bring to the NICU to help these families that did not benefit from the cribside cameras? Things that I would want to do differently. I would definitely want to have, a control versus experimental group, do that pre-test, post-test, one group design. I just feel like that would be a better way to kind of show the difference, or if these cameras, are helping, or yeah, just having, people who don't use it and then comparing that to the results of people who do use it. or the before and after. So that's something that I would want to do differently next time. And then also just updating the questionnaire. It'd be really cool to work with scientists that are really good at making measurement scales and tools. So yeah, being more um collaborative with making a questionnaire and just making sure that the questions are not really invasive and are culturally humble and ask questions that you know ask for the whole picture. So all right, and these are my references. So thank you everyone for watching. I look forward to getting to view everyone else's evaluation projects. Thank you. Oh my gosh.